When you measure a clinical outcome across many patients, something remarkable emerges. Individual responses scatter unpredictably, but their average stabilizes into a pattern. This stability is not a law of nature. It arises from aggregation itself. The central limit theorem formalizes this observation. As sample size grows, the distribution of sample means approaches a bell curve shape. This holds regardless of how individual patient responses are distributed. Skewed data, clustered data, even bimodal data, all average toward Gaussian form. The guarantee seems absolute. But convergence has a speed. Symmetric, well-behaved distributions reach Gaussian shape quickly. 20 patients might suffice for a symmetric outcome. Skewed distributions demand far larger samples. A treatment response skewed toward recovery may require hundreds of patients before the sample mean distributes normally. The theorem does not specify when the approximation becomes reliable. Heavy-tailed distributions expose a critical limitation. When extreme values occur more often than Gaussian theory predicts, the theorem fails. Adverse event reporting in clinical trials often exhibits this property. Rare but severe complications skew the distribution rightward. Even with thousands of patients, the sample average remains volatile and non-Gaussian. The bell curve never stabilizes. The theorem demands finite variance as its foundation. Without this condition, averages do not converge to any shape at all. In medical data, this means extreme outliers must be constrained. Some biomarkers exhibit unbounded variance in certain populations. When variance is infinite, aggregation provides no guarantees. Sample means remain as scattered as individual observations. The central limit theorem is powerful, but not universal. It guarantees a bell-shaped average only when variance is finite and samples are truly independent. In clinical practice, patients are not independent. Genetic background, environmental exposure, and prior treatment create correlations. When these conditions fail, the normality assumption collapses. Confidence intervals become unreliable. Treatment comparisons based on Gaussian approximations may mislead. Shape without explicit guarantees is not shape at all.